are you doing, Karen?
Good, how are you?
I'm good. I'm Nurse Sarah. I'm going to be doing your discharge instructions. Thank you for putting your phone away so we can focus on this.
Sorry.
Can you tell me your name and date of birth?
Dana Lamont, 6/14/89.
Perfect. So I'm going to be going over lithium, the drug that your doctor prescribed. Did she go over with you anything about the drug?
Yeah, she mentioned that it's going to help with my bipolar disorder, but she didn't go into too much detail as to what I have to do with the medication.
Okay, so I can help you out with that, and I'm going to leave a bunch of information here for you to take home in case you forget. So it's a mood stabilizer.
Okay.
So
what does that mean though, like a mood stabilizer?
So basically lithium helps stabilize your mood and reduce extreme behaviors like the manic and the depressive episodes by balancing natural chemicals in your brain. So like serotonin and dopamine and things like that, but you don't have to get into all that business. Basically the things that affect your happiness and pleasure. So when those two chemicals in your brain are balanced, the chances of having a manic episode are decreased. So it allows for you to function more normally.
Okay, so my mood won't be all over the place. I won't be so happy or so sad all the time.
Exactly,
Okay.
yeah. So we're giving you 300 milligram tablets of lithium. They're called lithotabs. And lithium has a really narrow therapeutic index, and all that means is there's a really small window between it being helpful and it being poisonous. So because of that, we have to monitor how much of the drug's in your blood.
So how am I going to do that exactly?
Well, you're going to have to come in twice a week at first to have some blood work done, and eventually once every 2 months, and we can make your first 2 appointments today before you leave.
Okay, good.
Also, the drug wears off really quickly, so you need to take your tablet 3 times a day. If you took it all at once, the blood levels would become toxic. So try and take it at the same time every day so you remember your doses, and if for some reason you forget to take it, just take it as soon as you remember, unless it's within 2 hours of your next dose, because you don't want to double up.
Okay, so can I take it with food? Like I can take it at breakfast, lunch, and dinner so I remember it's 3 times?
Perfect. And also, sometimes it can give you an upset stomach, and taking it with food can help decrease that risk. Also, make sure you drink at least 8 to 10 glasses of water a day to help keep flushing the drug from your system and prevent the toxicity. Also, consume the normal amount of salt that you normally do. Changes in the amount of salt in your body can either decrease or increase the lithium blood levels. So a low salt diet can make the lithium in your body rise, while higher salt can make it go down. So that means if you do strenuous exercise like on a hot day, and lose salt through your sweat, then your lithium levels can go up.
Okay, so how am I going to know exactly if these changes are happening if I do the same things?
So if you notice you're feeling shaky or weak, or your speech becomes slurred, or if you have diarrhea and vomiting, then call your doctor right away, because this could mean that you have too much lithium in your system.
Okay, so if I drink a lot of water and I get my blood tests and everything, that means that I'm going to have a lower chance of toxicity happening?
Yeah, correct. Also, avoid caffeine, because this can cause the lithium levels in your blood to go down.
Okay. What happens if my blood pressure does drop?
So basically, I'm sure the doctor was going through this with you earlier, that lithium can cause dizziness and lightheadedness and cause your blood pressure to drop. So basically just try and move slowly when you're changing positions. So when you wake up in the morning, dangle your feet on the side of the bed, sit there for a minute before you stand.
Okay, yeah, they had me doing that here. I would get up.
Alright, so you know the deal, you're good. Another unfortunate side effect is that weight gain can occur. So to prevent that, just try to eat small meals throughout the day, limit the amount of carbs you eat. You can weigh yourself daily to keep on top of it. Just before you change your diet, discuss diet options with your doctor.
Okay.
Also, lithium can cause problems with the rate and rhythm of your heartbeat.
So what happens if it does change the rhythm and rate?
So if your heart rate changes, you just might feel sleepy or confused, or if you experience fainting or difficulty breathing, then you should go to the emergency room. Other dangerous side effects that would require you to go to the hospital are swelling in your feet or your hands, or feeling really tired or weak, or if you change the way you're thinking, if you're thinking not clearly or not logically.
So how do I prevent that?
So just tell your healthcare provider about all the medications you're taking. Some medications can increase the chances of this happening. Also, taking lithium while you're pregnant can cause heart defects in newborns, so to prevent pregnancy, just discuss different birth control options with your healthcare provider.
I'm Catholic, so I don't use birth control, and I don't.
Okay. that's fine, and abstinence is appropriate.
Okay.
If in the future, once you're married, you want to become pregnant, just tell your doctor and he'll adjust the lithium levels so that it's safe. Also, when you're storing your medication, store it at room temperature, so don't keep it in your bathroom where it gets all hot and steamy when you're showering.
Okay.
Do you think you'll experience any difficulties taking this medication?
No, I mean, as long as I can keep these just to remind myself.
And I'm going to give you this brochure on lithium.
Okay.
And it just kind of breaks all this stuff down, plus you'll be taking home these discharge instructions too. Could you just repeat back to me, summarize kind of, so I know you have a good understanding?
Well, at first we're going to have to make appointments so I can get my blood levels drawn to make sure that it's not toxic at first and everything. I'm going to take it 3 times a day, and I'll take it with meals so I'll remember, so breakfast, lunch, and dinner. I want to keep the same amount of salt intake in my diet. I want to avoid caffeine. If I'm going to exercise because I don't want to have weight gain, I still have to not avoid like strenuous exercise like in the heat and everything like that. And I have to drink a lot of fluid, so I flush it out so I don't get toxic levels. And what else did you say? Oh, don't double dose. If I miss a dose, just remember to take it, when I remember, take it right away.
Perfect. So I'm just going to have you sign both copies of your discharge instructions. And if you have any questions, feel free to call and we'll help you out. I'll take that copy. Thank you so much.
Thank you.